Today I'm here with NeoQ, our winner of Best Use of AI in Healthcare here at the MedTech Awards 2025. Congratulations on the win.
Thank you very much. We didn't expect that to happen, but we are even more happy because it did happen.
Well, it did happen. Yeah. Here you are. So why don't you explain a little bit about what it is you do?
Well, we are trying to approach the global supply and demand gap within healthcare. So you have an aging population, you know, the aging pyramid. People are getting older, and of course, they are then in need of healthcare. On the other hand, you have governments like Saudi Arabia with the Saudi Vision 2030 to increase the access to healthcare, which is a good thing. But they, of course, then also adding to the problem because you have more and more people. On the other side, you have less and less people working within the healthcare industry. You have, work-life balance issues. You have less and less students who want to study medicine because they think AI will take away their jobs. So there is a huge gap. So you will not be able to close the gap if you're not using digital tools, may they be AI driven or not. And that was our initial thinking of developing something to help global economies and healthcare systems to bridge that gap.
I mean, I think AI is just fascinating in any industry, but I think if it can help in healthcare, it truly is so pivotal because, as you say, there's so many factors which mean that it's necessary and it's going to revolutionize healthcare in certain ways as well, which is exciting.
That's definitely the case, and I think within medical imaging, where we are actually focusing on, it's even a bit more advanced because radiology as such is very digitalized from the very beginning. So I think you can do a lot of things there. However, and that's something we see, it is the development is very fast. So the algorithms are learning from day to day. We have today 450 AI solutions. I think at one day, and it will not be long, maybe even next year or in 2 years, they will be gone because there's a Gen AI model that can basically outperform all of them. And I think we are before the curve, so we figured out how to do it, and I think that's also why our solution can be applied to any country in the world, also trying to bridge disparities and inequalities of care. So I think at the very end, it's not only a healthcare thing, I think it's also addressing the consumer within the patient, because we will be enabling the doctors to give the reports to patient right away, so they don't need to wait. They know what they have, and then of course the elective surgery, if necessary, can happen right away.
Amazing. I actually read about something very similar to this the other day, and it fascinates me. I just think there's so much that can be done with AI. As you say, it's also the speed of things and the validity of it, and then actually allowing the healthcare professional to give you more time to discuss whatever it is that needs to be discussed. So obviously you're being noticed of what you're doing, so congratulations.
Thank you very much.
Thank you.